The ones in yellow, nothing is changing for your SI tests. We're not adding anything new. However, for SI pathology, we have added some new tests, like the quadrant test, the single leg stance test can also do SI pathology. But the question was Koenigs-Brzezinski's straight leg raise test, slump test, tension sign bowstring test. Although we didn't explicitly talk about this last semester, if my patient had a space occupying lesion, so the opening where the nerve root is coming out, instead of it being its normal size, it is diminished. If I created tension, for instance, like on a straight leg raise test, and he had a space occupying lesion, that could result in a positive finding. So that anything new that we're adding here are for those tests, add space occupying lesion as a cause. So that includes the osteophyte, the tumor, the disc herniation, or the degeneration of a disc, which is narrowing the foramen.
So it would be perfection of neurological symptoms because of...
Yes. And most of the time it's going to be radicular. So if it's straight leg raise, it would just be on the one side. But if I did a straight leg raise and he complained of the neurological symptoms on both sides, it would be space occupying lesion, but in the vertebral foramen, because it's hitting the cord, and that's why he's got it down both sides.
And then a slump test.
Slump test?
Yeah.
All right, patient's position is seated off the end with his knees off the end of the table. He begins in an upright, natural posture. Clinician is off to the side. How to perform the test? He begins by rolling his shoulders forwards. Then he does chin to chest. We'll do it on this side. Then he extends this knee. Then he dorsiflexes that ankle. If he can do all of this and he has no symptoms, that's a normal test. Relax for a second. All right, now let me show you what a positive test would look like. So upright posture, he rolls forward, chin to chest. He extends this knee. When he does that, he describes a sensation on the posterior portion of his thigh. That could be either hamstring or it could be neurological. So what do? We back up that one step that caused the problem. I have him pick his head up so he's now looking straight ahead. So those two steps, I've relaxed the hamstring and the nerve here. I've additionally relaxed the nerve up here. So now I will ask him to go ahead and extend the knee. If the sensation comes back on the posterior side of his thigh, I know that must be hamstring because I doubly relaxed his nerve when we did that. Now, if the symptom doesn't come back, that would be suggestive that it is indeed the nerve. Let me give you one more example. So he's upright, rolls his shoulders forward, chin to chest, knee extension, no problem, dorsiflexion. Now he says, ooh, I feel something in the back of my calf. So I'm going to back up one step, back up this step here, the last step, eyes straight forward. Now I'm going to ask him to go ahead and dorsiflex again. If the pain comes back, the sensation I should say, comes back in the posterior calf, that has to be muscle related. If the pain does not come back, then we know it's neurological related. Did I say everything? What it's for? I think so. Okay.